Veno-occlusive disease is really a terrible complication after stem cell transplantation, but we can see VOD after auto transplantation and allo, but also outside transplantation. And it remains a matter of concern because there are probably new risk factors emerging. We can see, for instance, more and more older population receiving transplant, and age by itself, frailty, can be a risk factor. People are using more and more treosulfan as part of the conditioning regimen, and the recent EBMT publication and collaboration could show that treosulfan is part of those modifiable risk factors for VOD. There are cases now described in the context of CAR T cells. So, and more recently, we've seen some recommendation related to the risk of VOD in the context of gene therapy. So during this EBMT 2025 annual meeting, we had a lovely session about VOD management, about VOD diagnosis, VOD risk factors. And again, I think it is a rapidly evolving field. It's a dynamic field. And the conclusion from the different, I would say, available evidence is that early diagnosis is crucial in order to improve the outcome of patient. Because when you when you are able to perform an early diagnosis, you are able to have an early treatment, and obviously this will improve the outcome of patient. And this is why the EBMT refined the criteria for VOD that were published in 2023 during the annual meeting in Glasgow, actually allowed to introduce the concept of probable VOD. And I think this probable VOD category is allowing to achieve an early diagnosis of VOD when you suspect this complication. And this has been now shown in an independent Japanese series. We do have similar results from Spain, but also similar validation from the DEFI France registry. So you can see VOD remains a matter of concern, but I'm quite optimistic that more and more, when we are able to apply early diagnosis, when we are able to assess the risk, and there is a clear role for multidisciplinary teams and interventions, definitely the outcome of the patient is going to be improved. And of course, this is really good news.